Our group presentation is on Egypt. We are Group 3. Our members are Evangeline, Faithlin, Jenny, Kristen, and Sondas. Please enjoy our presentation.
Introduction. Egypt is located in the northeastern region of Africa. It is the most populous country in the Arab world, and it is the third most populous nation in Africa. Egypt is also home to the largest river in the world, the Nile River. The Nile River helps attract tourism and helps with agriculture. Egypt's current political system is based on republicanism, which consists of the president being elected by the absolute majority vote through a two-round system. The prime minister is appointed by the president and then approved by the parliament.
Prevailing diseases. According to the CIA World Factbook, the four most common diseases in Egypt are bacterial diarrhea, typhoid fever, hepatitis A, and schistosomiasis. People in Egypt are at risk of contracting these illnesses. Bacterial diarrhea is also known as a bacteria which causes infection in the stomach and in the intestine. This bacteria is known for spreading through drinking contaminated food or water. Typhoid fever is also known as enteric fever. It is known as a life-threatening bacterial disease. People carrying Salmonella typhi in their bloodstream and intestinal tract can spread the disease when a bowel movement occurs. Then the bacteria in their stool can infect others while handling food, drinks, or eating utensils. Hepatitis A is one of the most common diseases in Egypt. It causes a viral liver disease and then can also cause a chronic disease. It is spread by ingesting contaminated food and water, or by direct contact with an individual who is infected. Schistosomiasis is a chronic and acute disease that is caused by parasitic worms. It can be obtained by coming in contact with infected water.
Burden of the diseases by sex and age. Bacterial diarrhea affects females more than males in Egypt. This disease is very common in children that are under 5 years old. Typhoid fever is shown to affect males a lot more than females in Egypt. This disease is slightly common in Egypt for children that are under 5 years old. Hepatitis mostly affects women in both Egypt and high-income North America. The statistics for ages 5 and younger in Egypt shows females dying a lot more than males due to this disease. Schistosomiasis disease affects mostly females under the age of 5 in Egypt.
Burden of death and life years in Egypt versus North America. The burden of deaths of bacterial diarrhea in Egypt differs a lot compared to North America. Egypt's death rate is estimated to be 23.66%, while North America's death rate is 0.26%. The life years for Egypt is 22.38%, for North America it is estimated to be 1.2%. Typhoid fever's death rate in Egypt is approximated to be 0.034%, while in high-income North America the death rate is approximated to be 0.00033%. Hepatitis death rate in North America is 0.011%, while the life years in North America is 0.015%. However, in Egypt the numbers are slightly higher than in North America. The death rate in Egypt is 0.13%, and life years is also 0.13%. Schistosomiasis is not really common in both North America and Egypt. Looking at the statistics, the death rate in Egypt for all these 4 diseases is a lot higher than in high-income North America.
Key risk factors. According to the data, boys younger than 5 years old are at high risk of neonatal lower respiratory issues, chronic kidney disease, iron deficiency, protein energy malnutrition, and diarrhea. Boys 5 to 14 years old are at high risk of chronic kidney disease, iron deficiency, and protein energy malnutrition. The key risk factors among men from the 15 to 49 years old range are at risk of alcohol, drugs, ischemic heart disease, chronic kidney disease, diabetes. Men 50 to 69 years old are at high risk of ischemic heart disease, diabetes, hypertensive heart disease, chronic kidney disease, and chronic obstructive disease. Lastly, men 70 plus years old are at high risk of diabetes, chronic kidney disease, stroke, chronic obstructive pulmonary disease, lung cancer, and hypertensive heart disease. Girls younger than 5 years old are at high risk of neonatal lower respiratory issues, diarrhea. 5 to 14 years old are at risk of iron deficiency, chronic kidney disease. Women ages 50 to 49 are at risk of stroke, iron deficiency, drugs, diabetes, chronic kidney disease, ischemic heart disease, and hypertensive heart disease. 50 to 69-year-old women are at high risk of ischemic heart disease, stroke, diabetes, chronic disease, dietary deficiency, and women older than that are at high risk of disease, stroke, hypertensive heart disease, chronic kidney disease, and diabetes.
COVID-19 projections, cumulative and daily deaths. The current projections for COVID-19 reported and excess deaths are expected to go up by December 1st of this year. The current cumulative deaths are projected to go up to 22,371. The number of excess cumulative deaths are projected to be 281,144 by December 1st. The projections are also seen for the worst case, where 100% of vaccinated people stop wearing masks, and the best case, where mask usage is at 95%. Similarly, the number of daily deaths also have a similar pattern of increasing. The reported daily deaths are expected to be 116. For current projections, excess daily deaths are projected to be 1,460. Mask use. August 16, 2021, mask use was observed to be at 28%, and this percentage is projected to remain the same through December 1st. Social distancing. Using cell phone mobility data, mobility was observed at 4% on August 16, 2021. This percentage is projected to slowly increase to 13% by December 1st. Typical mobility is at 0%. Daily infections and vaccine coverage. The number of vaccinated individuals with one dose along with individuals who are fully vaccinated is projected to increase by December 1st. The projections for daily infections are expected to increase then take a slight dip for current projections and also for the worst case. However, mask use is projected to decline and then slowly increase. Hospital resource use. The number of all beds and ICU beds are projected to increase by December 1st.
The main priorities that should be addressed for Egypt is the increasing poverty rates, population growth, youth unemployment, and water and food insecurity due to climate change. The country is also very vulnerable to climate change and other global health issues such as COVID-19. With such a large population growth of 102 million people, there's no serious population control. Furthermore, only about 3% of the land is arable and is constantly close to being diminished due to the harsh effects of climate change. To continue, here are the keys to action needed to help benefit Egypt as a whole. A few main focuses should be towards the poverty rate and also help creating a shared prosperity rate between private sectors, academia, civil organizations, and youth groups. One program that focuses on these particular subjects is the CPF program, otherwise known as the Country Partnership Framework. The CPS focuses on Egypt's government long-term development strategy on 1. Improving governance, 2. Creating more jobs, 3. Social inclusion, which all could address the disparities found in Egypt. On the other hand, the CPF extension also helps improve the social safety net system for the parts of Egypt that are still developing. This includes providing access to affordable housing, expanding sanitation and water systems, as well as household natural gas, especially towards the rural areas. This also includes moving forward with the education and health programs. And that concludes our presentation. Thank you all for listening, and here are our references.